It's going to be my pleasure to introduce Dr. Dalia Rotstein. And before I share a little bit about Dr. Rotstein's bio, I would like to mention that this session in particular has been sponsored by Novartis, and we're very grateful to them for that sponsorship, without which we would not be able to have this presentation this afternoon. So let me say that it is my pleasure to introduce Dr. Rotstein. Dr. Rotstein is an assistant professor in the Division of Neurology at the University of Toronto. Dr. Rotstein is an attending staff neurologist at St. Michael's Hospital, where she works in the multiple sclerosis clinic. Dr. Rotstein's specialty training was in MS and demyelinating diseases at the Brigham and Women's Hospital, Harvard Medical School. She currently earned a master's in public health from the Harvard School of Public Health. Dr. Rotstein graduated from the Faculty of Medicine at McGill University in 2007 and completed a residency in neurology at the University of Toronto in 2012. Her research interests include the epidemiology of MS, comparative analysis of disease-modifying therapies for MS, dietary and nutritional influences on MS, and international neurology education. Would you please join me in welcoming Dr. Rotstein to share with us today?
Thank you very much, Joanne. So as Joanne said, my name is Dr. Dalia Rotstein. I'm going to be speaking to you today on environmental and genetic influences on MS. So I am a staff neurologist in the MS clinic at St. Michael's Hospital. I'd like to thank the MS Society of Canada for inviting me here to speak today, and also for hosting this wonderful event. And I'd like to thank you all for attending, for your attention, and for your questions in advance. So let's see, how do I move forward on this? This one? Oh, here. Okay, got it. Thank you. They don't teach us this in medical school. So yes, today we're going to be talking about both risk factors that can be modified, and there are some that can't be modified in terms of environmental and genetic risk factors. And we're also going to split it into factors that are associated with the risk of developing MS, and those which are associated with making the disease worse in those who already have the disease. And when we think about environmental and genetic risk factors of disease, it's often kind of split into this black and white picture of nature versus nurture. And this sort of scales of justice model comes to mind, such that if the influences of nature go up, then the influences of nurture go down. But this black and white picture is a little bit outdated, and I think you'll see as my talk goes on that today we're thinking about it in a more dynamic way, so that environmental and genetic risk factors can actually interact and modulate each other. So we'll be talking about that a little bit more later. Now, where MS is concerned, it's generally accepted that actually environmental factors play more of a role. That's because 80 to 90% of people with MS have a negative family history. There's actually nobody else in their family who has the disease. So that indicates that probably environment overall plays an more important role, and we're going to be spending the bulk of our time today addressing environmental risk factors. So I still have a picture up there of the double helix, so we can at least pay a nod to the genetic influences, but then you can see the various environmental risk factors we're going to be talking about, such as smoking, and of course I'm going to be encouraging you not to smoke, and then the sunshine vitamin or vitamin D, and then you can see the word salad, all of these different associations that we make with diet. I think an important question at the outset is, why do we study environmental and genetic influences on a disease at all? Well, curiosity plays an important role in this. MS is something that we deal with day in and day out, and we want to know, why does it happen? We also want to know, how does it fit into our own personal stories? So is there an event or an exposure that you can identify in your past, and perhaps that was a trigger and everything moved on from there? And I think that it is a very important part. It's a very human impulse to want to know how this fits into your overall story in your own life. Prevention is another very important aspect of this. So every day my patients ask me in clinic, how can I modify my lifestyle to prevent my disease from getting worse? And I think people are interested in natural approaches, kind of everyday things they can do that are going to help their overall life picture and their disease. Another question I get asked all the time is, could my children or other relatives get MS? And is there anything they can do to prevent this? So that's another very important part of it. A last important aspect is this idea of a cure. Could we someday cure MS? This is what we're all hoping for. And what does a cure mean to you? So I can tell you what a cure means to me, that I'd be out of my job. But of course, yeah, I'd be more than happy, though, truth be told, if it meant, there would be a cure for this horrible illness. But I think it's important to really think about this broadly speaking. So a cure in the traditional sense, when people talk about a cure to polio, for example, they talk about the introduction of the polio vaccine, and after that, we were able to completely almost wipe polio off the face of the globe. And we do hope for that someday with MS. But I think we can talk about a cure as well in a more modest sense. So a cure could mean halting the disease, so stabilizing a person where they're at in terms of their disability. And we are well on our way to achieving this with MS. Many of the MS drugs, have given hope of this, and there are new and more powerful drugs on their way. And a cure can also mean reversing the disability that has already occurred for an individual person. And unfortunately, we're not quite there yet, but there is very promising research, and there are new drugs in development. We hope to be there someday soon. So in terms of disclosures, just briefly, I have received research support from the MS Society of Canada and from Biotin, and I have served as a consultant for the following drug companies. So today we're going to spend the bulk of the time, as I said, on environmental influences on MS. We'll talk about viral triggers, vitamin D, smoking, the gut microbiome, which refers to the natural microorganisms in the gut, and diet. And then we're going to talk about genetic influences on MS, including gender and family. And lastly, we'll touch briefly on environment-gene interactions. Then we'll have some time for any questions you might have. So let's start off with viral triggers. Well, why might viruses trigger MS? MS is thought to be an autoimmune disease. And what that means is that in autoimmune diseases, the body attacks itself. And in MS, what part of the body is attacked is the brain and spinal cord, so the central nervous system, and in particular, the white matter or the connection fibers in the brain and spinal cord. Now, infections are known to precede some MS attacks, and it makes sense that there might be an infectious trigger of the disease because infections also stimulate the immune system. So if the immune system is hyperactive, such as it is in MS, it makes sense that there may be a particular virus or infection that is causing that to occur. So going back, researchers had this idea going back decades, and all of the common viruses came up as potential candidates. So they looked at the chickenpox virus, or scientifically known as varicella zoster virus, measles, mumps, rubella, and the various herpes viruses, including the genital herpes virus and HSV1, which is another common herpes virus. And all of those seem to be negative in the studies. But there was one virus where there seemed to be a link, and that was the Epstein-Barr virus, which is more commonly known as the virus that causes mono. So a lot of you might have heard of mono either because you know people who had mono or because you had it yourself. And a lot of people get it very early in life. And if it's very early in life, such as when somebody's a baby or a toddler, usually it's asymptomatic. But if people get it in their late teens or early adulthood, which is another common time, they often have symptoms, and they can have enlarged lymph nodes, a sore throat. They can get very fatigued, which can last for months at a time. And actually, over 90% of the population has had the Epstein-Barr virus or mono at one time or another. And this actually makes it quite difficult to study. But there was one brilliant study that was done out of the United States to look at this. And a lot of the studies I'm going to refer to were done out of Harvard University, out of the Harvard School of Public Health. There's a big group there that has been responsible for a lot of the major studies in the epidemiology of MS. So they used blood samples from military recruits in the US, and all of the soldiers were required to donate their bloods at the time of enlistment, and they were also required to donate blood samples every 1 to 2 years during active service. And these blood samples were tested annually for the presence of antibodies against the monovirus. Now, once somebody contracts a virus, they do develop antibodies, and those antibodies stick around in the blood even after the virus goes away and the person is better. So the EBV antibodies is an indication that that person had mono at some time or another. So most of the people who during follow-up in the Army developed MS did have antibodies to the monovirus at the time of recruitment. But they were able to identify 10 people with MS who were actually negative at the time when they enlisted. But all of those 10 people subsequently did convert to be positive for the antibodies, which meant they had contracted the monovirus in the interim. And all of their antibodies turned positive before the time when they actually developed MS. So that seemed to provide some indication that infection with a monovirus, with EBV, is a necessary antecedent to developing MS. So other studies from there have gone on to look at this in other ways. So they've looked at the level of antibodies to this virus, and there does seem to be a link that higher levels of antibodies to the Epstein-Barr virus, to the monovirus, are also linked with a higher risk of MS. And this graph here is a little bit complicated, but that line at the bottom, the dotted line at the very bottom, shows you people who were negative for the virus, so they have an extremely low, almost non-existent risk of developing MS. That middle bell-shaped curve is people who contract mono at a young age, and then the dotted curve, which goes up the highest, is people who contract mono in early adulthood. So they actually have a higher risk of MS overall. So mono is also known as the kissing disease. My husband and I, we have a young child at home. She's 16 months. We're already strategizing on ways to prevent her from getting into trouble when she goes away to school. But you can tell your kids that this is another reason to avoid kissing your dorm mates, is that you might get mono, and that could increase your risk of MS. And then that little picture with the fish over there is that it's a strategy you can tell your kids so they can fend off potential suitors in their dorm. But I think the ultimate message actually is that it's impossible to live life in a bubble. So there's really not that much we can do to prevent ourselves from contracting these viruses. And I don't tell you about these data and this research because I expect you to be able to go out and prevent people from getting infectious diseases. Of course, you know, there's simple basic hygiene like washing your hands, and you should do that. But at the end of the day, there's not that much we can do. So I think this kind of research is more important in terms of getting us thinking about the root causes of MS in a more global way. And it may indicate one potential target for developing a vaccine against MS in the future. Because basically, if we could develop a vaccine against this virus, potentially we could prevent people from getting MS at all. So there needs to be more research into this area. Now we're going to move on and talk about vitamin D. So the first inkling that vitamin D might be linked to people developing MS came from this, the world map of the distribution of MS. So what you can see from this map is that MS is very common in countries such as Canada, also in Northern Europe and Scandinavia, and in Southern Australia and New Zealand. All of these are countries that are far from the equator, where unfortunately we don't get a lot of sunlight, especially beginning this time of year. So when people saw this map of the world distribution of MS, it got them thinking about what the cause was, and sunlight became one issue. And we know that vitamin D specifically is converted from the sunlight that we absorb in our skin. So certain individuals might have a lot of their skin exposed a lot of the time to sunlight and may contract more vitamin D, but most of the time we know is quite limited. So actually, if you live in a warmer climate and your whole body is exposed for 20 minutes, you can get 10,000 units of vitamin D, which is more than we even need. But in Canada, it's actually very hard to get that. And that's because even if our skin is exposed to the sunlight, the way that the ultraviolet B radiation penetrates the atmosphere is an angle such that it isn't absorbed in the right way in our skin. So in Canada, we're really left with getting our vitamin D through dietary sources and also through supplements. Now there's a table there of dietary sources from which you can get vitamin D. You can see that the richest sources are cod liver oil is one, but I don't think we're taking in cod liver oil by the tablespoonful. And then other sources include salmon and some other fatty fish, and then dairy sources. But in dairy sources, you can only get about 100 units of vitamin D, so that's really not enough. So we're left with, needing supplements in order to get sufficient levels of vitamin D, or we end up being vitamin D deficient. So there were some studies looking at this, and the first studies concentrated about whether vitamin D deficiency was linked with the risk of MS, and the next set of studies I'm going to talk about showed that vitamin D deficiency can make MS worse in those who already have the disease. So the first study that provided some evidence of this was a nurses' health study. So this is a large cohort of nurses who have been followed for decades, since 1980. There are more than 100,000 nurses, and they basically have to provide detailed dietary questionnaires every 4 years, and those questionnaires include information about what kind of vitamin supplements they're taking. And they also asked some detailed questions every couple of years about what illnesses they had, so they were able to identify when these nurses developed MS. And what they found was that nurses who took more vitamin D through supplements had a lower risk of developing MS. So that's what the graphs at the bottom show. So you can see as you go from 1 to 5, the amount of vitamin D they're taking in is going up, and then you can see that the risk of MS, which is on the y-axis, goes down as the amount of vitamin D they're taking in goes up. And then the second graph, they just looked at whether, they tried to dichotomize it, whether people were taking no vitamin D or then less than 400 or more than 400 of vitamin D. So in those days, the usual supplement dose was 400. I'm sure a lot of you know, now it's more commonly sold as 1,000. So they found that there was even just taking 400, there was a lower risk of developing MS. There were some limitations to the study, which is that there were no direct measurements of vitamin D levels from the nurses' blood, and they only surveyed women. There were only, again, this is kind of the old days when most nurses were women, but they actually, even though there were some men who were nurses at that time, there were only women in this study. So it didn't tell us anything about the risk of developing MS in men relative to vitamin D. Also, there are many different things that can affect somebody's vitamin D levels. So both how much vitamin D they're getting through their diet, what kind of supplements they're taking, also how much time they're spending out in sunlight, and their individual genetics, because people's genetics can affect how they metabolize vitamin D. So then there was another study where they went on to measure the vitamin D levels directly from the blood, and here they used the that same cohort of U.S. military recruits because it was a very convenient cohort with a lot of blood samples. So they looked at the people who developed MS. They identified 257 soldiers who developed MS, so this time they had some men in the mix, more men than women. And they matched the people who developed MS against controls of the same sex, age, and kind of general characteristics. And then they tested their blood to see what their vitamin D level had been at the time of recruitment and also later on. So they found that there was a 41% decrease in the risk of MS with every 50 unit increase in vitamin D level. And that's what the graphs at the bottom show you. As the vitamin D level went up, the risk of MS went down. And this held true whether they were just using the blood samples or the vitamin D levels from the blood at the time of recruitment at around age 20, or even when they looked at the blood samples from later on. So then some of the researchers asked, they said, okay, now we know that vitamin D deficiency is related to the risk of MS, but maybe if we give vitamin D to people who already have MS, that could help protect them with their disease. It could prevent the disease from getting worse. So they first studied this in animals. There's a mouse model of MS, and they injected vitamin D into the mouse model, and they found that for those mice, the disease stabilized. So then they decided to test this idea in humans. So there was a study in Australia where they looked at the blood levels of 145 people with relapsing remitting MS, and they found that there was a decline in relapse rate, or the attack rate, in people who had higher vitamin D levels. So you may know that there are several different outcome measures we use in the relapsing remitting MS. There are relapses, but there are also new MRI lesions or plaques. So then another group decided to look at this in terms of the MRI lesions. So this was a Californian group, and it was a large cohort of about 500 people. And they found also that there was a lower risk of new MRI lesions in people who had higher vitamin D levels. And these graphs are just showing you the results of those two studies. So on the left, we have the Australian relapse study. So the green line is people who had higher vitamin D levels. So they they were relapse free for longer than people with low vitamin D levels, which is the blue line. And then on the right, we have the Californian MRI study. So as you move along the x-axis, the vitamin D levels are going up there. So at higher vitamin D levels, there was a lower risk of new MRI lesions. So why vitamin D? Well, vitamin D has a variety of complex effects on the immune system. So it's thought that that's why it's helping with MS, because MS is also an autoimmune disease. And vitamin D deficiency has been linked to other autoimmune diseases, such as type 1 diabetes, which is the type of diabetes that comes on in childhood. And it's possible that vitamin D may synergize with certain of the MS drugs more than others, depending on their immune mechanisms. Some of my own research has focused on that, but it needs to be replicated in other studies. And for now, we do recommend that everybody with MS, no matter what drug you're on, that you supplement with vitamin D. Unfortunately, there are no clear-cut guidelines about what exact dose of vitamin D to take, and it's usually treated as a one-size-fits-all, despite the fact that we do know that vitamin D levels are influenced by diet, sunlight exposure, genetics, and season, as I was telling you before. In general, the older vitamin D studies just looked at the blood levels, so that was one problem, is that they weren't giving a specific dose to people. Some of the newer studies have assigned a specific dose of vitamin D to people, but something that has become difficult for both patients and for the doctors who take care of people with MS is that all of the studies have actually used a different dose of supplements, so they still don't give us a great guideline about what dose to use. But one of the studies that was positive used 3,000, another used 5,000, so I usually aim for somewhere in between. So I recommend to my patients to take 4,000 a day, even though that's definitely not a clear guideline. Or you can, if you're able to get vitamin D blood levels, which we can do where I work at St. Mike's, you can target a level of more than 75. So that's another approach that you can take. Since we know that having higher vitamin D levels helps to reduce the risk of getting MS, I also recommend that the relatives of people with MS, if they're over age 13, take 2,000 units a day of supplement. If you have children who are under age 13, then you should speak to their pediatrician because the dosing depends on how old they are. So the bottom line is that vitamin D deficiency is very common in Canada. Supplementation really is low risk. Some people get a little bit of stomach upset, but there are no serious side effects. So I do recommend that everyone with MS takes supplements. So moving on, we're going to talk about smoking, which is another environmental risk factor for MS. So smoking has been linked to both the risk of MS and also the course of the disease in people who already have MS. And a very important observation is that smoking can accelerate progression in people who already have MS. And progression refers to the accumulation of disability over time in people who have MS. And this is important because right now, our drugs really don't treat the progressive aspect of MS very well. So the fact that there's a modifiable risk factor, something you can do in terms of your lifestyle that will help with progression, is, I think, a very important point. So this table here just refers to studies that dealt with smoking and the risk of MS. So basically, if the bars fell on 1, that would indicate no association. If it were less than 1, it means that smoking would actually decrease the risk of MS. More than 1 means that smoking increases the risk. And you can see that almost all of the error bars there are cleanly more than 1. And when all of the results were combined in something called a meta-analysis, where they combine the results of various different studies, again, it was clearly above 1, indicating that smoking increases the risk of MS. So this is one study where they looked at smoking relative to conversion from relapsing remitting MS to secondary progressive MS. So the black line there is never smokers. The green line is ex-smokers. The red line is current smokers. And on the y-axis, so going up, is the probability of people surviving in relapsing remitting MS, so not converting to secondary progressive MS. So basically, the people along the black line are doing the best. So the never smokers, a larger proportion of them do not convert to secondary progressive MS over time. So again, evidence that smoking increases the risk of progression in MS. So what recommendations emerge from this? Well, I guess it's kind of self-evident, but if you have MS and are a smoker, try to quit. So there are a lot of different strategies today. There are a lot of different pharmacologic approaches. So I'd encourage you to meet with your family doctor to try to work on that if you're smoking. And I would also advise family members that not smoking may reduce their risk of developing MS. So moving on, we're going to talk about the gut microbiome. Well, the gut microbiome, it's kind of a buzzword these days. So what exactly is the gut microbiome? It refers to the more than 1 trillion species of microorganisms that live in our guts. That can include small bacteria, parasites even, fungi. And these microorganisms help us fight off infections. They also help us metabolize the foods we eat. And this is making the news a lot recently. So you can see it's made the popular press, so the cover of The Economist, and there it is on the cover of a prestigious scientific journal, Nature. And each individual has their own signature in terms of the microorganisms in their gut. But there are distinctive patterns, and it seems that certain patterns are associated with autoimmune diseases. One hopeful aspect to this is that the gut can be repopulated, even in people with a distinct pattern linked to autoimmune disease, using fecal transplants. I know, don't jump for this all at once, or probiotics, which might be an easier route. But I think this research it's still in its infancy, so it's too early to encourage you to adopt these treatments. Some of you might be breathing a sigh of relief. Anyway, it has been linked specifically to MS. So when gut microorganisms were changed in the mouse model of MS, those mice actually did not go on to develop MS. And there have been preliminary studies in humans which have found distinct patterns in people with MS. So the Methanobrevibacteriaceae, I'm sure I butchered that, are more common in the guts of people with MS, and the Butyricemonas are less common. So these are a couple of the findings to date, but as I said, there are millions, in fact 1 trillion microorganisms, so there's a lot left to be discovered. I think the main message for individuals is that ultimately the gut microbiome is something we could potentially modify. And we know that both diet and also drugs, including the MS drugs, do modify the gut microbiome. That has been studied in a preliminary way. So those are potentially promising avenues for intervention. So that's a nice segue into talking about diet and MS. So here are a few, ideas that come to mind when we think about diet and MS. So there are a lot of different diets which have been popularized for MS. Unfortunately, there hasn't been a lot of research into this area, and I think a lot more needs to be done to try to clarify some of these questions. So the top picture refers to Dr. Walls, who's a doctor who herself actually has MS and developed a diet for MS which is high in vegetables, I think in particular kale. I don't think it's been extensively studied at this point. I think she did some preliminary studies herself, but it hasn't been studied by any external group. So unfortunately, I can't tell you, whether this diet works or not. There's also the Swank Diet, which I'm going to tell you more about in a few minutes. That's one of the oldest diets that was pioneered for MS. And gluten-free diet, again, I can't really tell you anything definitive about. I have a lot of patients who have gone on the gluten-free diet. I actually looked into studying this myself at one point, but it's actually very difficult to quantify in a specific way the exact content of gluten in foods. So, we don't have anything definitive that way. So there's a lot of interest in diet and MS, but unfortunately, as I said, there's very little evidence at this point. The most definitive evidence applies to vitamin D supplementation, which we already talked about. I'm going to talk about diet a little more broadly speaking today. So the idea that diet in a broad sense might be linked with MS came from the finding that, in fact, adolescent girls who are obese or have high BMI actually have a higher risk of developing MS. So there have been various kind of scientific studies that came out of that finding. So there have been potential associations which have been shown in some scientific work between having a high salt intake and MS. And recently there was the International MS meeting just 2 weeks ago in Barcelona, and there was a big study that was announced where they found that fatty acids with high branch numbers also seem to potentially make MS worse. And that would mean kind of a low fiber diet, potentially making MS worse. But again, it's just one study, so it's not definitive at this point. There have also been 2 studies actually which have shown a potential link between low intake of omega-3 and omega-6 fatty acids and the risk of MS. One of those studies came out of the US and one came out of Australia. So I think that's still an evolving story. We need to pay attention to it, but it's too early to reach any definite conclusions. So just a few words about the Swank diet. So this was developed by a doctor. And the idea for it came from the observation that the incidence of MS was very high in Norway, which we know it's very high, as I said, in northern countries where there's low sunlight. But they found that within Norway, the coastal communities actually had a relatively lower incidence of MS. And that, the hypothesis for that was that it might be linked to something in their diet. And we know that in coastal communities, a large share of the diet comes from fish. So Dr. Swank developed this diet which was high in polyunsaturated fatty acids, because we know that fish is a good source of the polyunsaturated fatty acids, and other foods that are high in the PUFAs are sunflower seeds, canola, corn, and soybean oils. So that was the basis for his diet, and he also encouraged low intake of the saturated fats. So he followed a cohort of people with MS on this diet, and he did report improvement. But there were some limitations to his work. Namely, he had a vested interest in this, because you can see he published the book from it, etc. So there's a little bit of a conflict of interest there. And also, it was a non-randomized study, which is not the gold standard for determining whether a treatment works. So other external groups have since studied this diet. So there are 2 other major papers that were published, and they did not find that this diet made MS better. So at this point in time, it doesn't seem like there's good evidence for the Swank diet. So during my fellowship, I wanted to look at dietary patterns and whether they were related to the risk of MS. So dietary patterns is a relatively modern way of thinking of diet, and it counts for the way that people often eat certain food groups in tandem, so different foods seem to go together. It also takes a more holistic approach to analyzing diet to see if overall you're eating in a healthy way. So what constitutes eating in a healthy way? Well, it's a diet that's considered to be high in vegetables, fruits, whole grains, and healthy protein, like fish and poultry, and then low in red meat, saturated fats, and refined sugars. So I looked at this in the Nurses' Health Study. Again, that's that very large study of nurses that were followed for several decades, where they answered questionnaires on their diets every few years. And people were graded by different scores according to how closely they conformed to a healthy diet. So there are different scores that have been developed around this. They all adhere to the same principles, but they emphasize slightly different things. So for example, some give points for salt intake, some don't, but these are kind of finer details. So basically this graph shows, we looked at the dietary patterns, and we looked at them both according to diet at baseline and also at mean cumulative dietary scores over time. So basically, if the error bars cross 1, then it indicates there's no association between the dietary score and the risk of MS. So you can see on this graph, actually all of the bars cross 1. And what that means is that we did not find any association, between the diet and the risk of getting MS. And that held true, whether we looked at just the baseline diet or also the mean diet over time, which is the second graph. So I think hopefully this does provide some reassurance in a way that it's not the fact that you weren't eating healthy early in your life. We know we all sometimes eat junk food as kids, right? That determined whether or not you got MS. This study doesn't tell you anything about whether diet can play a role once you already have MS. So I think separate work needs to be done in that area. Just a word about another small study that was kind of an exciting development at the recent international meeting. So they looked at whether a vitamin supplement might be helpful in progressive MS. This is so important because we really don't have much in the way of treatment for progressive MS at this point in time. So they looked at a dietary supplement called Biotin, which is vitamin B7. It's a water-soluble vitamin. It's also known as vitamin H. That's a nickname because it's thought to be helpful with hair, kind of strengthening hair and strengthening nails. So this was a small study out of France, but it was randomized, where they looked at 100 people with progressive MS, and about half of them were given the high-dose Biotin. And they did find that it seemed to make a small but significant difference, and it actually made a difference in making their disability a little bit better, which is quite impressive. One caveat to this is that it did take some time until the improvement was observed, so it took 2 to 8 months after the treatment was started. And also that they used a very high dose relative to what you can buy at the pharmacy. So usually this is sold as 100 micrograms over the counter. And what that means is that you'd actually have to take 3,000 of the pills over the counter to get this dose, which is not feasible, I know. I don't know why they came up with this particular dose in France, but it is possible that you could get the dose potentially through a compounding pharmacy. I've spoken to some colleagues in Quebec and Massachusetts. I know they've been able to identify some pharmacies where you can get it. I don't know of any in Ontario at this point in time, so if any of you do know, please let me know, because some of my patients have asked about it. But it is something you could possibly call around to different pharmacies and ask if they could do it for you. As far as the study went, even though this is a very high dose, it didn't seem that people had any serious adverse events related to it. I think there was some mild stomach upset people had at times, but it didn't seem like there were any serious complications. And it's interesting that this is actually a vitamin that's involved in various metabolic processes, including synthesis of fatty acids, which has come up in some of the other literature. Natural sources of it are peanuts, liver, and some green leafy vegetables, but again, in quite low amounts. So at the end of the day, what can I recommend? Again, vitamin D supplementation. I don't think you can go wrong by eating healthy, which means a diet high in fruits, vegetables, whole grains, good fats like nuts and olive oil, fiber, and low in red meat, refined sugar, saturated fat, and processed foods. So at the least, it'll help your general health, which can help, in particular, your cardiovascular health and thus preserve mobility for a longer time, even if it doesn't impact the MS directly. And at best, there could be some associations with MS that are still being unraveled. So, you might as well, I think, take the risk of eating healthy, which really, isn't a risk. And I think, we talked a little bit about fatty acids. That story is still evolving, so I would stay tuned. So we're going to move on now and talk about genetic influences on the disease. And of course, one of the key things that we get from mom and dad is gender, whether we have 2 X chromosomes or an X and a Y. So probably a lot of you know that MS is more common in women. Probably need to only look around this room to say that. So I've actually studied this in Ontario from the administrative data, and for every man that has MS in Ontario, there are 2.4 women with MS. On average, though, MS is more severe in men. However, the good news is that the mortality of MS is going down in both men and women. So this is some of my recent research. So the prevalence of MS in Ontario refers to all of the people with MS in Ontario at any point in time. And you can see that the prevalence has been rising slowly over time in both men and women. But I can tell you that the incidence, or the number of new cases of MS each year, is stable. So what explains the increase in prevalence? It's the fact that mortality rates are going down. And you can see that from the second graph at the bottom, that for both men and women in Ontario, since the mid-90s, mortality has gone down substantially. So I think at the end of the day, this is really good news. And, things are going in the right direction for people with MS. So the second important aspect, of course, of the genetic story is, in families, what kind of genes we get through mom and dad. So in a perfectly heritable disease, in a disease that is 100% genetic, they do twin studies, and they find that in identical twins, the concordance rate is 100%. What that means is that if one of the identical twins gets a disease, the other twin is guaranteed to get it too. But from the top row of this graph here, you can see monozygotic twin, which refers to identical twins. So there, the risk of MS is only about 30%. So this is an indication that more of this disease is due to the environmental risk factors. Because even in identical twins, if one twin gets it, the other one only has a 30% risk. And if you go to fraternal twins, which is listed here, the scientific term is dizygotic twins. I'm sorry, I don't have a pointer, so I can't point it out exactly. But the risk in fraternal twins is only 5 to 10%. And if you go to other first-degree relatives, such as a parent or a child, the risk is about 3%. So overall, it's quite low. It still is a little bit higher than the general population, but again, I hope that's a reassuring piece of information for people. So do genes contribute to MS? Yes, they do, but only to some extent. And 80 to 90% of people with MS actually have a negative family history. There is no single MS gene. There's no gene we can point to that we say if the parent has it and it's passed to the child, then the child is guaranteed to get the disease. No, there is no gene like that. There are various genetic loci which have been associated with MS. The one that's associated with the strongest risk is HLA-DRB1*15. I know that sort of seems like alphabet soup, but that gene increases risk 3 times if you have 1 copy of the gene. If you have 2 copies of the gene, it increases the risk 6 times. And there are other genes in that same family that also increase the risk a little bit. And there are numerous loci, more than 25 other loci, that can increase the risk of MS, but by very, very modest amounts. So that brings us to the story of gene-environment interactions, because it seems that having these genes is far more important in the context of certain environmental risk factors, and it's the way that they interact that actually spell the picture in terms of being a causal link for this disease. So the new idea of nature versus nurture is not that they're at loggerheads to each other, but actually that they come together at an intersection, at a crossroads. And in particular, this is being appreciated more and more in MS. So there's some recent research that shows that if you have this HLA-DRB1*15, you can have worse MS if you have low vitamin D levels. And there's actually a scientific explanation for how the gene and the vitamin D interact, because there's a binding site for vitamin D on the promoter region of that gene. And the promoter region just kind of directly precedes the gene itself. So that's kind of cool there, that we actually figured out exactly how the environment and the gene were interacting. And then there are a few other genetic alleles which have been identified, which are associated with a much higher risk of MS in smokers, and they're listed there. So this story is growing. There's more and more research into this area of how genes and environment are interacting with respect to MS. So in conclusion, we've talked today about some environmental risk factors for MS which are modifiable. So those include vitamin D deficiency, smoking, and possibly diet and the gut microbiome, although more needs to be learned about those factors first. There are other risk factors for MS which include genes and gender. And those, there's not much that we can do about ourselves, so they can't be directly modified. But it is, very important to be aware of these as root causes of MS, because they can lead towards research which will hopefully direct us towards better treatments, and I hope someday a cure for this disease. So to summarize, we talked about environmental influences on MS, genetic influences on MS, and lastly, the environment and gene interactions. And now I'd like to open up the floor to any questions. Yes.
Thank you for all this. This is awesome information. A few years ago, I used to be a dietitian in one of my other lives, but then a few years ago when I was out west, I got interested in the TCM diet because I had a practitioner in acupuncture, but really studying that. And then since then, involved with the gut flora and not having enough money, finally getting into nourishing traditions. There's a book on the traditional way we used to eat. So it promotes the ability to grow all your own foods, but to digest, increases digestion in amongst it, and the gut bacteria, and really eating and keep your body pH at the normal level. But the lipids now, the synthesis of lipids, and I can speak, I guess, from experience, I have noticed improvement in nerves, like I've been able to get rid of one of the braces in my right side and my cognitive and so on. But it does work with keeping your gut flora active and eating right with your lipids. And there's a lot to be said. It's in the early stages and it's just being recognized now in the medical literature, which is really cool. That's kind of, but I've got lots of information I've researched on my own and working with no money. You can do it.
Mm-hmm. Yeah, that's great. No, and I hear about this as true, about the effects of diet every day from patients, too, in my clinic. And one thing, I want to emphasize that I didn't mention about the talk overall is that all of these studies, refer to population studies, what we call epidemiologic studies. And what we find when we look at a large number of people with MS. But what's true on a population level isn't always true on an individual level. And just because we don't have population level findings to indicate something doesn't mean, for individual people, you can't point to something that will work. But this is the way science works, is that we have to prove something over a large population of people. So I can tell you about the limits of science, but it's interesting to hear about people's personal stories too.
I can add that a lot of the things that I've experienced, it is in the literature, the science now. Okay. It's being proven. So right. I can attest to it because I've done it.
Sorry. So kind of to the same topic, I guess, for the gut micro. I take a lot, I'm on a lot because I'm more, the initial line of medication doesn't work, so I've gone up. And I find a lot of it does bother my stomach. Mm-hmm. And I have been trying different probiotics, but is there a certain test or anything that I can get done for my gut to see?
Yeah, not as far as I know of. And again, the part of the problem is that a lot of the science for the gut microbiome is in its infancy.
Okay.
There are studies going on right now of probiotics for MS patients. It's hard to recommend one specific probiotic over another, but I think a lot of them do have the same end result of repopulating the gut.
Okay. So just the ones I've been taking are like microorganisms, so I have to keep it in the refrigerator. Would you recommend more live ones or like the dry stuff you buy at pharmacy?
And so I can't recommend anything like just because there's no.
No, I know
there's okay. Nothing proven.
Just wondering.
Yeah, sorry.
Hi, thank you. My question is actually based on the vitamin D levels being so far away from the equator. Is there any correlation to us using so much sunscreen or sunblock to prevent the good sun vitamin D from our body being absorbed?
There is some relationship to that. It is a good question. It's actually more of an issue in the kind of hotter climates, because when people wear sunscreen, for example, in Florida, then suddenly they're not getting the vitamin D through their skin that they did before. In Canada, because of the way the ultraviolet B radiation comes in, we don't actually, even with or without sunscreen, we don't get that much vitamin D through our skin. We probably get a bit more during the summer. So it's true that wearing sunscreen during the summer may slightly lower the vitamin D levels that you would have otherwise. It doesn't mean, I still recommend sunscreen, because we know that not wearing sunscreen increases the risk of skin cancer. I think it just makes supplementing with vitamin D that much more important.
I was advised for my kids to not put sunscreen on them for a very short period of time, perhaps 15 minutes, 20 minutes, so that they could have direct exposure to the sun and then get them lathered up.
Yeah, I think that's reasonable.
Okay.
Yeah.
Hi, maybe I missed it. How old do they have to be before you can start vitamin D on children?
So you can start it earlier. Some of you might know that even a lot of babies get the vitamin D drops, but I just can't recommend the dose at that age because it has to be adjusted to the age of the child, so you'd have to ask your pediatrician. But in terms of taking the 2,000 a day, it should be safe from adolescence onwards, from around age 13 onwards. So that those kinds of doses have been studied in teenagers and they've been fine.
Just a quick question about probiotics. How often should you take them? Because if you read the bottle, they say, take for a few months and then discontinue use. Should you take it all the time? Should you just take it sometimes if you feel like you have stomach upset? Just kind of curious. I know you mentioned something about probiotic ingestion before, but just wanted to ask specifically, should you take it daily or just sometimes? Or
Yeah, it's a
your
tough
thoughts?
question. And sorry, I'm not an expert on probiotics because, like I said, there really isn't evidence for it now in MS. There are some groups which are studying it. So they're going to, they're developing protocols. And then if their protocols work, we'll be able to point to their protocols to recommend them. But at this point in time, it's hard to say. Yeah.
Can attacks be seasonal, like common, like every year or every couple of years around the same couple of months? Like usually May or June is attack happening?
Good question. To my knowledge, on a population level, we don't think they're seasonal. For individual people, certainly I've heard about seasonal predispositions, and I've heard about people finding that their symptoms are worse during certain seasons. I can tell you that risk of MS in some ways does appear to be seasonal. So there's what we call a month of birth effect. So depending on what month of the year a child is born in, there can be a slightly increased risk of MS. That's thought to be related to vitamin D and the amount of vitamin D you get through your mother in the utero. So actually babies who are born in the spring months have a higher risk of MS, and that's because during the winter months it's thought that they get less vitamin D from their moms.
That makes sense because she was born in April, and pretty well almost every year, it's either April, May, or June that she has an attack. So this is.
So you can try supplementing if you're not already, but we don't know all the causes that might contribute to MS, so that might not be the only thing that explains it.
Apart from vitamins, is there definitive research on minerals? There's been some talk of zinc, copper, selenium, manganese, iodine.
So no, there's no firm indication that any of those minerals are a causal factor of MS. Sodium, which is kind of like a mineral, again, has been raised. I'm going to try to study that more in Toronto, and there are a few different groups looking at that. Some of the MRI studies have found that there's a higher sodium content, kind of salt content in some of the MS lesions, although that might not be directly linked to diet. So it is an area of interest. I can tell you that having low copper levels can separately cause damage in your spinal cord. So having a healthy, and also having low vitamin B12 levels, a lot of you probably know this already, can cause some issues with the nerves and spinal cord. So it does make sense to have a healthy diet and get all the minerals as recommended.
I just read a recent study from ECTRIMS, the European thing on a German study. Well, I didn't read the study, but it was just mentioned the sodium propion,
propionate. So that was I had a one-liner on that study in my talk.
Yeah.
So they found that short-chain fatty acids, and propionate is a short chain fatty acid, seem to make the animal model of MS slightly better. Propionate, I think it's like a dietary additive that a lot of times is added to like bread products to kind of prevent molds, etc. So that was sort of interesting work. One interesting aspect of it is that actually all the fatty acids they looked at were all saturated fatty acids, which we don't usually think as helpful or good for your health. But I think it's very interesting work, and they seem to do a rigorous job, but usually before we accept something into the field, we want to see it validated by another group, so it has to be replicated by other groups first. So, that's a story we're going to continue to watch.
So, and that goes back to your fatty acids. You had corn oil, soy was one of them, and canola. Now, those have been genetically modified for a lot of years, and I've heard that they have led to a lot of the gut dysbiosis in a lot of people. Is that something that we should be trying to make sure we do? And they're put in all different kinds of foods, the sort of thing that you don't even realize. Is that something that might be useful watching because we want to keep our gut bacteria normal?
Well, it's hard to say because there are some other studies showing that maybe polyunsaturated fatty acids, specifically the omega-3s and omega-6s, could be helpful. So, I just think there needs to be more work done before we can reach conclusions.
Can you explain one more time the HB1-15 allele binding to vitamin D?
Yeah. So he said to explain. He requested that I explain one more time the binding of the that allele I referred to, HLA-DRB1-15 with vitamin D. So that's an allele, genetic allele, which has been associated with the risk of MS and also with a worse course of disease in people who already have MS. So as I said, if you have one copy of the gene, your risk increases 3 times. 2 copies, your risk increases 6 times. So the issue with the binding of vitamin D is that vitamin D binds to the promoter region of the gene. So the promoter region of the gene isn't part of the gene itself, but it precedes the gene and it helps with activation of the gene. So when the vitamin D binds, it appears that activates the gene.
Do you think that inhaling secondhand smoke as a child can increase your risk of developing MS?
Yes, I do. So there have been, studies and other literature outside of the neurology literature, but showing that the effects of secondhand smoke, if you're exposed consistently to it, are almost identical to the effects of smoking yourself. So yes, I think it can also contribute to the risk of MS.
This is a comment more than a question. For those of you who like to read and study more about what you can do for yourselves, I've been reading recently a book called Brain Maker, and it concentrates largely on the gut microbiome. I'm finding it very interesting. He cites different studies, and these are recent studies that have been done. So if anybody would like to pick up a copy of this at your library or something and read it, it's great talk, reading about the microbiome and prebiotics and probiotics.
Thank you. Have you studied the correlation between high serum ferritin, aka iron, in MS patients? Our son, we accidentally found out last year that his serum ferritin was in excess of 600. Males in Canada ideally should be between 30 and 300. It jumped to 3,100 in June, and when he was in the hospital, they gave him prednisone, and it subsequently came back down to 700. But could this high serum ferritin be a cause of increased degradation of his system?
So it's hard to answer that. I haven't studied it myself, and I'm not aware of much literature around that. I think that Dr. Bruno, if I wasn't here for her talk, but I was told that she might have had a slide around anemia and the risk of MS, so that might be linked with iron levels. But based on what I know about how iron works, and ferritin, it can be a measure of how much iron you have in your system, I don't think there's an association, but I don't think it has been well studied.
I actually have one, Dr. Rothstein.
Sure.
I'm just wondering about digestive enzymes. Is that something that you recommend people take after meals to ensure they're digesting and getting all of the vitamins and minerals out of the food?
I wouldn't recommend it at this time because I think we should have the digestive enzymes we need. And again, it's not an area that has been studied really at this point in time, but as you know, we are learning more and more about the role of the gut microbiome, so it may be something that becomes of interest in the future, but I think at this point in time, I wouldn't suggest it.
Last call for questions. Anyone else have a question? No? Okay. Well, Dr. Rothstein, we would like to thank you sincerely for the excellent presentation you gave today. We learned a lot, and it's just very helpful to continue to increase our knowledge and understanding of what might be contributing to MS and what we can do to live a good life to stay healthy with MS. So on behalf of the MS Society, I would like to present a small little gift for you, and thank you very much for your time today.